Hey, good morning. My name is Kenny Ng from IBM Research. This is work done by members of my team in collaboration with an intern from MIT and clinicians from the Inova Heart Institute and Sutter Health System. And what I'll be introducing you today is Clustervision, which is a visual supervision of unsupervised clustering of patients. So there's actually two aspects to this work. One is the development of this interactive visualization tool, and then the second aspect is the application of it to a clinical use case. So the tool itself is designed to help the data scientists evaluate a number of different unsupervised clustering methods without having him do all the work. So we, behind the scenes, would actually do a large number of different clusterings with different methods, different parameters, and then we present the top cluster results to in the UI to allow the ability to do a comparison with respect to quality, technique, and parameters. We're able to compare clusters within a clustering result. We're able to compare data point with respect to other data points within the same cluster, and also to be able to get a little bit more insight into why data points are grouped together, and to also allow interactive generation of new clustering results. On the application side, we've applied this to a number of different use cases. The one I want to highlight here is to identify heart failure phenotypes. And this was inspired by some work from Sanjeev Shah, published in, I think, a 2015 circulation paper, where they used unsupervised clustering to identify subgroups of heart failure patients with preserved ejection fraction. So we tried to do the similar experiment, but using data from our collaborators from Sutter Health System. And we use features from DHR consisting of comorbidities and medications similar to what was done in the Shaw paper. We wound up with about 1,400 patients with preserved ejection fraction heart failure and extracted these types of data features from a 2-year observation window before the diagnosis. So the one difference between this and the Shaw paper is that they looked at phenotypes classification after diagnosis. We were trying to look at time window before to see if we can find out different groups of patients with different etiologies to preserve ejection fraction heart failure. So once we extracted all the data, we then applied it or used the tool to do the unsupervised clustering. So as I mentioned before, a lot of the challenges are, what algorithms you want to use, how many clusters, what parameters. And so this tool is really designed to help facilitate that process and try to do as much of the work up front and let the data scientists and the clinicians be able to work together and introspect the clusters and better understand the results. So in the Shaw paper, they wound up using hierarchical clustering with 3 clusters at the end. And our question is really, given our interactive system, are we able to find sort of better, more optimal clusters of patients? What I want to do here is just to run a couple of videos showing you some of the key features of the tool. So on the left-hand side, we show the top results after hundreds of clusters. So we show top 15 clustering results. Each row shows one clustering, and the radar chart basically shows the criteria on which to judge the quality of the different clusters. You can select any of the clusterings, and then what we do is show on the top a scatter plot of the projection of the patients. Each point represents one patient, and then on the bottom we show the top factors that differentiate the clusters, and a coordinate plot that shows the value for each of the patients. Each one is a line for each of the clusters, so you can see how the clusters compare with the top variables. Here we're just highlighting several of the different clusterings. This is the group with the 2 clusters. And then we'll also highlight a group with a much larger number of clusters with 20. So you could see, for example, all the different colors for the different groups and the different corresponding coordinate plots. And then this one here with the 5 clusters. And what we see with the 5 cluster group is that weird. What we see with the 5 cluster group is that we were actually able to identify the same 3 clusters that were found in the Shaw paper, but we also found 2 additional groups that were very different from what was found in that paper. And we're continuing the investigation to better understand the differences between the new clusters. All right. All right, I'll stop now. I think I'm out of time. There's some additional features in terms of being able to compare clusters and to introspect them more. So here I'm just showing, if you highlight 2 clusters and then you can see the differences visually between the results of the 2 clusters. So we found that this is a very useful tool to be able to better understand interactively results from unsupervised clustering. Thank you.